Hello and welcome to episode 7 of our series of podcasts on the National Cancer Plan. The UK's National Cancer Plan aims to deliver world-class cancer care and focuses significantly on personalised care and what support patients need to help them through their treatment and the recovery and to live beyond their cancer care. In this episode, I talked to Teresa Corbett, our Programme Manager for Personalised Care at Wessex Cancer Alliance, to get her views on how we address the ambitions set out in the plan.
Hi Sally, thank you for inviting me to share my views. What stood out for me is the National Cancer Plan has an entire chapter dedicated to designing cancer care around people's lives. It really acknowledges that the experience goes far beyond just diagnosis and treatment. It talks about quality of life as a central outcome, supporting people not just to survive cancer, but to live well, to continue their daily activities, roles, relationships, and to manage cancer alongside the lives that they want to lead. The plan highlights the need for modern, flexible, personalised care where the system adapts to each person rather than expecting people to fit their lives around the healthcare services that they access. It also recognises that cancer is something that many people are now living with long term, and that means that people need joined up support well beyond treatment for late effects, other long-term conditions, financial pressures, and also psychological well-being. It really positions people as active partners in their care, and that they should be supported with continuity, clear information, and coordination across the different settings. And finally, it calls for much more proactive community-delivered care, shifting support closer to home and reducing unnecessary hospital visits. So that community-level model is essential to supporting people with the day-to-day realities of living with and beyond cancer.
What do we need to do to make these ambitions a reality for people living with cancer across Wessex?
Well, we're actually starting from a very positive position here in Wessex because personalised care already features strongly across our programmes. To bring the plan to life, we need to continue shifting more cancer support into neighbourhood settings so that people can receive care where they live, reducing time, travel and disruption to their routines, and also just enabling them to live their lives doing what they value and what they prioritise. We need to deliver personalised care and support planning that truly reflects people's real life priorities, whether that's work, caring responsibilities, mobility challenges, cultural needs or financial worries. This needs to be linked to a comprehensive assessment of a person's needs and also recognising things like their capability, their self-efficacy and their opportunity to engage with healthcare. We need to expand prehab. So rehabilitation for cancer is about supporting people before and during treatment so that they can cope better and recover more quickly and maintain their strength and independence. We'll also be exploring what this might look like in relation to late effects support. So we need people to be supported to stay independent, manage longer term physical or emotional impacts and feel able to get on with their normal lives. Stratified follow-up and remote monitoring are also key, and those mean that people only attend hospital when they really need to go, giving them more freedom to live their lives. And because so many people have other conditions or complex needs, neighbourhood teams need to be equipped to support that, preventing crises and helping people to stay well for longer. And things like working well with voluntary and community sector will be really important with that. Their local support and local knowledge can make a huge difference to people's well-being, particularly around things like finances and social connections, especially after treatment.
The plan also states that every cancer patient will have a named neighbourhood lead. Could you describe what neighbourhoods are and what this might look like?
Yes, of course. So a neighbourhood is a term that we're using for kind of joined up working that brings together the NHS, public health, local authorities, social care, primary, secondary care, voluntary and community sector, all working together in a local area. Neighbourhoods are shaped around people's lives, about the place where they live, so not necessarily organisational boundaries, and they should really reflect how people actually live their lives. For people with cancer, neighbourhood care has the potential to really make everyday life easier. It can reduce duplication, simplify access, and a named neighbourhood lead is part of that. The role might look slightly different in each area, but I guess the principle is the same. There'd be one named person who's a consistent point of contact and helps people to navigate through treatment, recovery and long-term follow-up. So they might coordinate support across community services, cancer specialists, diagnostics, social care and wellbeing services. And crucially, we'll be able to spot any issues early. So whether that's late effects, emotional concerns or practical needs, that they'll be able to identify any issues early and escalate them, or refer on to other teams when needed as well. So it helps to really ensure that people are getting the right support at the right time in the right place for them. And it helps to ensure that their personalised care plans are up to date and really reflect what matters to the person. We have a really good example of what that could look like in Wessex through the Right By You programme. So Right By You already functions very much like a neighbourhood cancer lead. It's a community-based outreach model delivered by cancer clinical nurse specialists. They support people where they live, working closely with GPs, community teams, and also linking back into secondary care as well. The service focuses particularly on people who often struggle to access support, so those with complex needs, people living with social isolation, or other forms of vulnerability or complexity in their lives. So what Right By You shows is a really good example of how neighbourhood-based care can be personalised, proactive, and really reduce the work of being a patient by taking some of the worries and the coordination from off the patient and helping them with that. It can prevent emergency attendances by managing symptoms early, coordinate support across multiple agencies, address those emotional, social, practical needs as well as the clinical ones, and help people live well during and after treatment. And we've got an independent evaluation that shows us exactly that, with improvements in experiences and outcomes as well as real system benefits. So it's a really strong foundation to build on as the national neighbourhood model is rolled out.
And how do you see Wessex Cancer Alliance supporting or fitting into these neighbourhoods?
Yeah, so I think we've got a really big role to play in supporting neighbourhoods as they develop. We've written a really detailed document that sets all of this out clearly, including our vision and suggestions of how neighbourhood cancer care can work in practice across Wessex. And we'll be sharing that as part of our wider kind of implementation support for developing integrated neighbourhood teams across Wessex. We also have offers in relation to training and workforce development, so that people across all neighbourhood teams, not just cancer specialists, feel confident supporting people living with and beyond cancer. And we'll also look to try and develop cancer pathways like Right By You, and also prehab models that could be delivered in the community that can reduce burden on individuals and support them closer to where they live. We're also exploring ways to strengthen data sharing and digital connectivity so that treatment summaries, care plans, remote monitoring data can follow people wherever they receive care, and that people will have access to really credible information digitally, but also that data is informing decisions about where services are needed and how services can be improved. So using that kind of neighbourhood level insights and analytics to identify those at risk of deterioration, social isolation, or people who are high healthcare users, to identify how we can support them better and help them to reduce healthcare use, but also improve their experience of care as well. And also another thing that we do is we bring together different system partners, so across acute, primary, community and voluntary services together, so that we can align pathways, reduce variation and ensure that care is really genuinely shaped around people's lives and what's important to them.
And are you looking forward to seeing these plans evolve?
I really am, yeah. I'm excited to see such a strong national focus on personalising care and supporting people to live well, not just through treatment, but afterwards as well. I'm really looking forward to the potential of neighbourhoods becoming places where people can access that practical, holistic, everyday support, the kind of support that really genuinely makes it easier to live the life that you want to live. So we know, there's going to be challenges, and we're working in a system with real workforce pressures and variation across areas and risks of services becoming fragmented if we don't stay aligned. And we know that there's things like long-standing inequalities and access issues that have to be addressed. But there's also huge opportunities. We have strong partnerships across Wessex, a culture of innovation, committed teams in every part of the system, and neighbourhoods that are full of really strong assets, experience and community relationships that we can build from. And we already have great examples like Right By You, showing what's possible when we can bring that support closer to home. So I always use a quote from Arthur Ashe that says, start where you are, use what you have and do what you can. And I think it's that kind of a simple reminder that we don't have to wait for everything to be perfect before we can progress. We can build from what we already have, and I think that's really got to be the spirit behind neighbourhood working. So I'm genuinely optimistic. With stronger collaboration across Wessex, we can improve the day-to-day experiences for people living with and beyond cancer. And ultimately the ambition then is that no matter where somebody lives in Wessex, they'll receive that coordinated, personalised support through every stage of their experience of cancer.
Thank you, Teresa. Our next podcast focuses on children and young people, as we have a whole chapter in our new cancer plan dedicated to their care and future treatments. I'll be talking to Laura Bengry to hear her thoughts as lead clinical nurse specialist in our principal treatment centre in Southampton of what she thinks about the chapters and the opportunities for children and young people across Wessex. Thanks for listening.